Welcome to First Star Let's Chat, an athletic therapy podcast. I'm your host, James Gardner, certified athletic therapist, certified strength and conditioning specialist, yoga instructor, human being. This platform, for the pros, by the pros, anybody in the performance space, and beyond. Welcome here to share in the stories of professionals, experiences, journeys, learning along the way. It's a platform to connect, to network, and to be a part of a community that cares, with conversations that matter, experiences that resonate, and generate ideas, thought-provoking, organic dialogue, passionate pros. Brought to you as always by First Star Therapy, Mobility Tape, Epic, and Benchmark Athletics. In association with the Canadian Athletic Therapists Association. It's First Star Let's Chat, an athletic therapy podcast. Thanks for being here. Thank you for being a part of it. All right, welcome back. It's First Star Let's Chat, an athletic therapy podcast, the official podcast of WFAT. Here with Michael Higgins from University of Virginia. He is a PhD, a PT, an ATC, and a strength and conditioning specialist. Lots of details and backgrounds. 2 workshops today: optimizing squat mechanics for rehabilitation success, and then thoracic manual therapy for neck and shoulder pain. 2 diverse topics, or 2 separate topics, but you could do it all. So welcome. Thank you for your time. I know you just did 2 workshops, so probably talked out. Let's start there. How did you become as diverse as you are?
Well, first of all, thanks for having me on, James. It's always fun to be here, and it's a pleasure to be involved with the World Federation in Athletic Therapy and Rehabilitation. It's fun to meet individuals from all walks of life and from all different at this international conference. It's really neat to do that. Basically, my 2 loves are human performance, strength and conditioning, but strength and conditioning more in regards of how can I apply it to everyday life, and also the use of manual therapy. And basically, by the means of use of manual therapy, that's manual therapy of all stages, all types, and how we can utilize those 2 things. Everyone thinks they're really different, but a lot of times they're similar, because I have to be able to move to be able to perform. And usually manual therapy helps us move better, helps us to become less painful. And then if I'm less painful, I can move better. If I can move better, I can perform better. So if my back is sore, I can do maybe some manual therapy with it. My back is less sore, then I can go into, say, the workout room and do squats pain-free, do deadlifts pain-free. Things that I need to do, as we talked about earlier, on an everyday basis.
Yeah,
right?
and that integration is beautiful. And I had the opportunity to sit in on the beginning of one of your workshops, and the takeaway piece for our audience that's here, for our audience that's listening abroad, you have ample expertise in a lot of different areas, and you've taken a named exercise and also plug that into a lived experience, a livable skill, as I talked about, active, daily living skill of squatting. We need to be able to get down, get back up. We need to be able to pick things up off the ground. How do you navigate that in a performance space, and then sort of like the generic everyday life space? So athlete versus non-athlete, is there a difference? What's the difference in your mind and an approach standpoint, I guess?
Overall, I don't think there's a main difference. I think there's a continuum, but I try not to look at it as a huge difference between the 2. So we look at the continuum as I'm just beginning, and then I want to do this to help make me become better at a sport. But I also look at it as a continuum of everyday living, but I want to make sure that I'm better at getting up out of the couch, getting up out of the car, or just picking something up off the floor without causing discomfort. Versus I want to squat 500 pounds and it's going to make me run faster, or it's going to make me jump higher. Similar things that you look at together. So if I have an older patient, I'm still going to have a deadlift, I'm still going to have a squat. Probably to not the extent that I'm going to have a athlete do the same thing. So my programming will be a little bit different. I'm still concentrating on the same things. I'm still concentrating on technique. I'm concentrating on form. I'm concentrating on what they need to do. So I gear my exercise programs on what their ultimate goal is. So if their ultimate goal is to say, get off the toilet or get out of the couch without any problems, get out of the car without any problems, I'm working on that. So I'm going to increase their strength, but am I going to do it the same way as I would for someone who wants to jump higher? No, but I'm using the same principles, just in a different continuum that I have. I'm still using the periodization principle or block programs for both. It's just how I modify those programs to best accommodate what that athlete or what that person wants to do in real life or what their ultimate goal is.
Yeah. What can't you do? What do you need to do? And then how do we modify that? And I love that capture of a continuum. Before we dive into some of the parameters and sort of the modifiables, you're at University of Virginia, just for our audience. What do you do there? What's your current role? And I guess, how did you get to that point?
My current role is I am the program director of the Masters of Athletic Training program. To be an accredited program through KD, Commission on Accreditation of Athletic Training Education, you have to be at professional level or master graduate level, as we all know. So I've been there for 9 years. I'm the founding director of their program. They used to have a post-professional program, which was one of the first in the country. And then when that sort of petered out, then I was brought on to develop the curriculum for the master's program. Before there, I was at Towson University for 12 years. I ran their program and did some clinical athletic training work there as well. And then before that, I was at the University of Delaware as a half-time professor, really, and then a full-time athletic trainer, where I worked with mainly lacrosse, basketball, and then some soccer, football, as you look at it through here. But when I was there in the 90s, early 2000s. We only had 3 full-time athletic trainers for 20-some sports.
Right.
So we did almost everything for them. So that's how I got. And then before that, I worked as a physical therapist, athletic trainer at a sports medicine center in Baltimore, treating outpatients it was a sports medicine center. We saw mainly athletes, but we saw very active people as well. So if one of the orthopods wanted us to be a little bit more aggressive with someone, they'd send us those patients.
Okay. So again, a continuum, and you've taken all of that and taken the let's call it a little bit more academic side of research and made it applicable. And I think for me, that's a massive takeaway. For our audience, it's a massive takeaway. These can be 2 separate streams. That blend, I think, is the nuance, it's the artistry of what we do as practitioners. You did a wonderful job capturing that in the squat mechanics workshop that I had the opportunity to sit in on. I'm sure plenty of takeaways for attendees. We'll get to your takeaways from being here at World Congress too. Modifiable parameters, you look at the hip, the back, the ankle, you look at version, anti-version, retroversion in the hip, all of these things, these modifiable parameters, are those pretty common practice? Do patients understand that? Does that come down to delivery on the practitioner's piece to make it livable for somebody getting off a couch?
I think everything comes down to delivery. You can talk way above a patient's head, and you can sit there and go, oh, I know all this academic speak.
Yeah.
And they're looking at you like you have lobsters coming out of your ears.
Yeah.
Right?
Yeah. So
I think what makes a clinician better is to be able to take all that, synthesize it, and make it understandable for the patient that you're dealing with, or the person that you're dealing with, the athlete, patient, whatever. You have to make them understand or be able to understand why you're doing certain aspects of your program. It just can't be do this. Who likes to be told what to do without knowing why they're doing it? If there's a reason behind why you're doing it, then they have a better idea of, yes, if I do this, I'll get better because I can do this now, right? So if I do this squat this way, it means that I'll be able to get up out of a chair, or I'll be able to jump higher or run faster or lift more, versus just do it. Well, why? Give them the why, give them the how, and then they can see the end result of that. So to me, if you talk to them in the language that they understand, I'm not saying that they're dumb or anything like that, but you're just talking to them in the language that they understand. Versus if you went to a computer programmer and they were talking all language of computers, I wouldn't know what they were talking about,
right? But
they broke it down into simplest terms. Fine, I understand it. Same thing you have to do with medical terms, right? You're not going to say, "Oh, you have an anteverted hip." They're going to look at you like, "What?" Just don't know my hips turns a little bit this way. Show a picture, and then they'll at least have an understanding of what you're doing and why you're doing it.
Yeah, circle back to the continuum. I'll just use that as the theme of our conversation. The athlete who's squatting to get bigger, stronger, faster, or to get better at squatting, that's also a continuum. That's going to serve them not only now, but serve them hopefully later in life to be able to get up off the couch, out of their car, and do those things. It's a livable pattern. Is there a little bit of snake oil, I guess, in the space in terms of there's one way to do this, and you always have to be the example given, knees over toes. Is that for everybody? Is it not for everybody? How do you approach sort of, I don't know, some of the mysticism around squatting or deadlifting that's out there?
Everyone has a podcast. Everyone has a webcast. Everyone has an opinion. Now, whether that opinion is based on scientific fact or evidence or clinical experience is another story. And that's something that I think a lot of people have a difficult time disseminating what is good information, what is bad information. And part of the lecture is everything is individualized. Everyone doesn't squat the same way. Everyone doesn't run the same way. Everyone doesn't deadlift the same way. So that we have to look at that patient or that athlete and tailor the squat to them.
Yep.
So everyone's built a little differently. So that's what part of that program was, is like, how do we individualize squatting patterns for specific individuals without causing discomfort, with increasing movement ability. So if I decrease discomfort, increase ability, I'm going to increase performance, probably no matter what, a lot of the times.
Yeah.
Because if you're pain-free, you feel good, I'm going to move better, feel better, perform better.
Yeah, and in your opinion, obviously through your experience, a breadth of it, a lot of depth here. You've been in a lot of places, done a lot of things, still teaching, still active. Obviously in the gym to look at you, don't have you on camera right now, but obviously still active. Those pieces of sort of just like growth as you go along. Manual practitioner, you do some stuff with the upper back, the shoulder, the thoracic spine mobility manual therapy, and then you have the human performance. Sometimes it's seen as two distinct things. In your opinion, valid opinion, do those things have a natural blend? Does it make a better practitioner to have both skill sets?
Definitely, because I was talking to colleagues this morning, and they're giving a talk on shoulder mechanics and throwing in the overhead athlete. Well, if your spine doesn't move well enough, say if your thoracic spine doesn't move well enough, your scapula is not going to move well enough, and then your glenohumeral joint's not going to move well enough, and then what's going to happen? I'm going to end up with arm problems, pathological condition in the arm. If I don't disassociate my lumbar spine from my thoracic spine and get some of that rotation, I'm going to end up with issues. So they are a continuation. Like if my lumbar spine is really tight and my thoracic spine is really tight, so I can't sit into that squat, that's going to cause me to have, how am I going to modify that? I'm going to transmit those forces somewhere else, hips, knees, ankles, whatever. I'm going to end up with abnormal forces being generated, and that's going to lead to problems somewhere along the lines.
Right.
So to me, everything stems from trunk or the core. I like to call it the trunk.
Yeah.
And my definition of trunk is mid-thigh to basically scapula. It's not abs. Okay, abs are incorporated into it, but it's not just because I'm doing core. I just do the right. No. To me, as I said, mid-thigh to scapula, it means glutes, quads, lumbar spine, thoracic spine, scapular stabilizers, everything involved that way. And those things all have to move in concert with one another for us to get proper motion. And as I keep saying, you have pain-free motion, you're going to get better, you're going to feel better, you can perform better, you're going to do better.
I love it. It's speaking my language. I hope lots of people's language are opening their eyes to seeing this. Michael Higgins from the University of Virginia, taking some extra time after presenting 2 workshops. Really appreciate your time. We chatted, in the breakfast room, introduced ourselves. I think that's a good takeaway for me, is just saying hi, introducing ourselves. For you, coming to World Congress, you're delivering a lot. What do you hope to take away from World Congress, from being here as part of this international?
I want to learn.
Yeah. I
want to learn from my international colleagues. So it's going to be interesting to see, because everyone does things a little bit differently. Right? Everyone thinks, well, okay, this is the way you do things. Oh, did you try it this way? Did you try it this way? Did you think about this? Did you think about that? That's how I learn. By talking to people, right? And by sitting on someone who may have to do things differently based upon where they're located. They may not have all the fancy equipment, but I do it this way. Neat. great idea. I can take this back and do what I want to do. Exchange ideas, right? Well, I do it this way. Well, I do it this. Why do you do it that way? Because of this. Never thought about that. Great idea. So I like to come here to learn from other individuals.
Beautiful. And you did a great job. Again, I was just in there briefly this morning, made a great capture. Just sort of, if you have a phone, most people have a phone, you can take a still shot, you can take a video, you can then apply a small goniometer for those that have those and look at degrees and angles. It doesn't have to be all of the technology to make this look or feel a certain way or to be expressed. So I love that. That's a great takeaway. Hope you get the opportunity to learn, travel around, see the area.
Just by talking to people, James, you learn.
Yeah.
And sometimes I learn better outside of the presentations when you're sitting there enjoying social conversation with someone and you talk shop for a little bit over a beer or something like that. And then you just got to have a Guinness in Ireland, right? So I got to have over Guinness, talk shop over Guinness. And sometimes you get more from that than sitting down there and sitting into an hour workshop.
Yeah.
You just talk to them, just talk about, so how do you do this? How do you do that? And you learn so much better that way.
Yeah.
At least I do.
Yeah, I think it's brilliant. It's individual for you. And I think it's a connection piece being here in person and having that opportunity to do that both formally and informally. Last one before I take up too much more of your time. We're in Ireland. We're in Maynooth, which is a little bit northeast, a little bit west of Dublin. You have family here. You're going to see a different country as well. So have you been here? What are you going to explore? Have you explored?
No, I've never been to Ireland before. I've always wanted to come here. And I was just talking to my dad and his great grandparents, my great grandparents from here, Ellen Delaney and Michael Higgins. And my brother looked at some of the genealogy, and there was a Michael Higgins who signed in at Ellis Island a long time ago. So it might be the same person from here. So I do have roots here, long ago roots, but it'd still be interesting to see some of the heritage and see where they are and see if there's any of the Higgins clan around.
I love that.
Anymore, so some of that, and just I want to enjoy the local. I always hear local Irish is pretty cool. They're friendly, they're opening, and they're welcoming. So I want to go to the local Irish pub and just sit down and someone said, get locked in.
Yeah. Well, lots of places to do that right there.
Yeah. So to me, that's what I want, just explore the country as itself and see not just the tourist stuff, but outside of that and around there and see what Ireland is, true Ireland, get a picture of what it is.
Yeah. Really good captures. You get the personal bits, you get the professional bits, and you get to wrap it all into an amazing conference here, an international event. We'll leave it to you to just sort of close this out. You are the first workshop leader to be on the podcast here at WFAT. This is the 13th World Congress. Really appreciate your time. Really appreciated your workshop that I had the opportunity to sit in on, and look forward to chatting with you informally as well. Wherever you want to close this out, to our listeners, thank you for listening. Michael Higgins, University of Virginia. We'll put some contact information in the podcast notes.
Sure.
If you're okay with that. Look into the program, look into what he's doing, the biomechanics of squatting, the squat patterning, a livable thing. It's a continuum, and here we are continuing the chat.
That's great, James. I do appreciate your time and coming. Let me chit chat with you for a little bit, and I'm very appreciative for the World Federation to have me come and present. And it's an honor to do that, and it's great to see how everyone else does things. And it's a great learning environment. And to me, that's how our profession grows and gets better, is by the communication and by the sharing of ideas, and that makes us all better. So it's fun. It's a great experience, and I'm very happy to be here. And thanks for having me on the podcast.
Yeah, thank you for the workshops. Thank you for being here, and look forward to traveling down this road again. Maybe into the future, we'll dive in a little bit more on the squat and some other things at depth. This was just a capture. Michael Higgins, appreciate your time.
Thank you, James.
Thanks again for being here. Thanks for listening. Thanks for being a part of this community. Check us out online, firststartherapy.com. That's FIRSTAR therapy.com. Or email us with feedback, consult@firststartherapy.com. CONSULT @firststartherapy.com. firststar.com, on Instagram at firststar.therapy, and our podcast host at letschat.at. This is First Star Let's Chat, an athletic therapy podcast.